welcome back.
Yes, welcome back to episode 2 of our first season, the children's series. Yes,
Channel is
Medical Diaries.
yes, the Medical Diaries
Yeah,
with Dr. Ann Maina.
and Tama Mbugua.
Yes.
Mm.
So don't forget to subscribe,
Like,
and
comment.
share.
Mhm.
Um,
Yes, we are talking about breastfeeding today.
mhm.
Yeah, it's a very interesting topic
Mm.
and very huge. We cannot like cover the entire details of breastfeeding. Yeah.
But we are going to try to like do the main things
Yes.
which we think will help you.
Yeah, which are
'cause
important.
usually najua when you go to clinic, when mothers go to clinic, they're told breastfeed for 6 months, exclusive breastfeeding. I don't know whether you're usually told the importances,
The benefits, yes.
why are you told to actually do that? So today we are going to cover some of those things.
Yes.
And we hope you enjoy. Yeah, we hope you enjoy. We are going to keep it short.
Yes.
So we're going to cover most of the things. You can follow us on our socials.
Yeah.
Ask questions. You can slide into our DMs. Ask the breastfeeding questions that you have. You can also just ask on the comments below. We will be sure to
answer all of them. Yeah.
Yes. Yeah. So breastfeeding.
Okay, so breastfeeding is feeding a baby the breast milk after birth. Yeah. So breastfeeding, we're gonna start with what types?
Yeah, we can start with types. But before that, if you are a mother and you want to keep your child out of hospital, breastfeeding is the way to go.
Yep.
Let me tell you, breastfeeding has so many benefits. One of them being immunity. Keeping your child out of hospital, the first thing you have to do,
Yes.
breastfeed. Make sure you breastfeed.
You can,
unless otherwise. There are people who have maybe breast cancer.
Yeah.
There are people who are not able to breastfeed. But if you're able to breastfeed, God gave you these two breasts.
Yeah, they're there for a reason.
They are, of course, apart from cosmetics and beauty, and the main use is for breastfeeding. Yeah. So we're going to maybe just briefly talk about the types of breast milk. So usually there are three main types. Of course, there are other types, but that is what we're going to talk about. We have colostrum. Colostrum is the first milk that is usually produced between what days?
0
to 1 day.
Yeah.
That is usually produced. It's thick and yellow. The first milk that your baby feeds on. So it's called colostrum. Colostrum has a lot of immunoglobulins and proteins.
Yeah.
Immunoglobulins are the ones that give your baby just natural immunity.
Yeah.
And then colostrum will help the baby digestive system to develop.
Yeah.
When the baby is born, usually there's most of the development obviously has happened in the uterus, but then there are those small ones.
Yeah, that happen after delivery.
Yes. So it prepares the baby's GI, the baby's intestinal system, gastrointestinal system. Okay, the baby's gut. Yes. It prepares the baby's gut to digest what? To digest
the breast milk.
The breast milk. So it's very important in that way. One, immunoglobulins, which are basically for immunity, and then the development. Then after colostrum, now there's the other milk that comes. Usually 48 hours later, and then onwards. But now that breast milk is also divided into foremilk and hind milk. Foremilk is the first milk. Maybe wakati mtoto ameamka, there's that milk yenye is produced fast.
Yeah, the moment sasa kumekuwa
maybe for the first 5 minutes. It's usually watery.
Yep.
And it also has a lot of it has proteins. Mostly it has proteins and water. So it's the first milk. And then maybe 5 minutes after that, now there's the hind milk. Yeah. The hind milk is very rich in fats and
It's very rich in fats and sugar.
Yeah, and sugar. So the hind milk is important for is I won't say that it is more important than the fore milk, but it is very important for adding of weight.
The weight,
yes, adding of
very
weight.
important.
Very important. Hind milk. That is 5 minutes and afterwards. That's why mostly we usually tell our mothers when you're breastfeeding, breastfeed the child for at least 20
to 30 minutes.
20 to 30 minutes on one breast.
Yeah, just the first one. Ile tu ulimwekea ya kwanza.
Wacha breastfeed for at least 20 minutes so that they can get both the fore milk
and the hind milk.
Yeah. Utapatanga maybe sometimes mothers wana change. Ananyonyesha hii 5 minutes, amenyonyesha hii 5 minutes.
And with very silly excuses.
So unapata mtoto anapata tu hiyo fore milk yenye haina a lot of fats and sugar. Sugar in at least in a tribe it helps keep the baby's sugar levels.
Yes.
Zikiwa hapo constant. Usually we want them to be above 3. But the moment you change the breast, it's not advisable. So utapata mtoto haongezi kilo vizuri nini. So usually we advise mothers mtoto akiamka breastfeed one breast then alale. Then the next time anaamka breastfeed the other one until anatoa hiyo matiti yote both fore milk and
the
hind milk because both of them are important. Now this one will bring us also to the mothers who have twins. We usually advise them every twin should have their own
breast,
should have their own should have their own breast. Sababu utapata kuna twin moja mwenye anamkanga wa kwanza anakunywa fore milk, hiyo mwingine mwenye amelala sana anawachiwa anakunywa hind milk. So utapatanga ule mwenye anamkanga wa kwanza ndio anamkanga wa kwanza all the time because amenyonya hiyo fore milk yenye iko very watery nini, so haishiki tumbo. And then ule mwenye amenyonya wa mwisho analala pia sana na hiyo ndio anaongeza kilo. So that's why we advise them every twin should have their own bowl. Ndio apate both fore milk
na
hind milk. Yes. And then of course kuna kwangana other things like if one breast is infected, I don't know. Anyway, I think that is it about types. But not the benefits and why we tell you what we tell you.
Yes.
And if you've not been told, please
imagine we are never trying to make it like we are the ones who know things, but we just say these things so that you can do the right thing to you and for your baby, for you and for your baby. Nikwangi kuringa because some people don't follow these instructions or they heed to this health education, alafu now you get that their babies are having problems.
But
they're getting
probably they don't follow because they're not told the reasons.
Okay, health workers, do the right thing.
Tell them the reason why you're telling them that. All right.
Okay, so we go to benefits of breast milk. We've already emphasized on immunity. It is very important. So of course immunity, the baby is we're going to avoid the baby getting childhood illnesses like diarrhea diseases which are very unnecessary. And then breast milk is ideal for nutrition. Of course the baby is getting the protein, the sugars, the fats, so anaongeza weight and we get
basically a balanced diet.
It's kama tu mtu mzima. The baby is getting a balanced diet. Okay, then the other one, we are lowering risks of allergies. Hizi homa za ufala tu. So of course the baby hatapata homa enye tutavoid pia kupata joto zenye haziko and very many childhood illnesses. Okay, another thing that we have benefits even for the mother. We know that the most common causes of postpartum deaths for the mothers is bleeding. So breastfeeding your baby actually helps to reduce the bleeding, the uterine bleeding, because there's a hormone that is produced by your body as a mom. That
oxytocin.
Oxytocin, yes. that helps your uterus contract. The faster it contracts, the lesser bleed.
So when the baby breastfeeds, there's more production of oxytocin, so the uterus contracts.
Yes.
Less bleeding.
And also there's also bonding between you and your baby, which is very important.
It's the most it's the most important thing.
Yes.
Hapo kwa bonding, are you going to talk about postpartum blues and
postpartum? Yes.
Because utapata sometimes wamama wengine wanazaa and maybe they were not prepared psychologically.
About the
childbirth. Yes. So ameshtuka anashindwa, oh my god, what is happening? And that goes hand in hand with postpartum depression. So breastfeeding helps reduce all those things. So the moment mtoto anashika matiti, you're like, oh, it's easy enough. So
when you make like you build a closer bond with your child. The other thing is it lowers risks of cancers, ovarian cancers, breast cancers,
and even endometrial cancer. So we say that one of the risk factors for endometrial cancer, one is nulliparity. Nulliparity are women who don't have kids and failure to breastfeed. So there's a lower risk for women who breastfeed and who have more children. Same applies to breast cancer actually.
Yes. These hormones that are produced when you're getting children and everything, inasaidia sana when it comes to avoiding these things like cancer. Okay. Our next subtopic.
Okay, so I think you talked about what? Benefits. Benefits for both the mother and the child. You didn't talk about kangaroo maybe?
Yeah, kangaroo child care, mother care. Okay, kangaroo is when
you know how a kangaroo carries the baby.
Hapa kwa kamfuko. So actually tunasemanga mama atoe kama amevaa gown, okay, avae gown yenye huku mbele open, yes. And then your baby also havai nguo. The only thing anaweza labda ni kadaipa. And then we put the baby with you on your chest. And then we put on a shuka, tunakufunga tu vizuri,
unamfunika vizuri so that you skin to skin, it's actually it's basically skin to skin contact of the baby and the mother. And kangaroo is also practiced by fathers.
Yes, it's important by the way.
And it promotes bonding. So unatoa mtoto nguo unamwekelea hapo kwa kifua ya baba, skin to skin contact. The baby, it helps the baby anajua baba.
And also keeps the baby warm.
Yeah, there's warmth and there's also immunity apparently. So it also promotes immunity. Hiyo skin to skin contact.
Sasa we encourage you guys, even you men, you practice kangaroo.
Kwa wale watu wako kwa places za baridi na unakuja hospitali tunakwambia show yako ni kadogo, skin to skin contact. Mtoto haizi kuwa baridi. Alright. So those are mainly the benefits. I think we can talk briefly about positions.
Yes.
Positions of breastfeeding. So this is very important.
We cannot exhaust this discuss topic.
So let me tell you about positions of breastfeeding. I like talking about positions due to back pain. So unapatanga unapatanga mama amekuja hospitali with back pain that is maybe a few weeks after delivery. Sababu you find out the position in which they sit while they're breastfeeding is poor, very poor. So we will put some two captions here so that we can show you the different types. But unapatanga wamama the chair I'm sitting in is a bit comfortable, so it's easy to breastfeed on such a chair. Enye iko hivi. Lakini unapatanga mama ameketi mahali hivi, ameinama hivi. Alafu ameinama hivi. So huku nyuma ama maybe the back is not resting somewhere. So unapata mtu anaumwa na mgongo.
It is bad. People complain sana by the way.
Make sure when you're breastfeeding you are comfortable. You yourself.
Yes.
Because when you're comfortable, pia ita encourage unyonyeshe mtoto the required amount of time.
Yes.
when you're uncomfortable utachoka haraka na utanyang'anya mtoto matiti mapema. Probably hata haku ameshika.
Utakuwa unafanyia mtoto vibaya na wewe mwenyewe.
Because usually tunaambia mama breastfeed until mtoto mwenyewe alale aachilie matiti mwenyewe. Unajua kuna mama wanaonanga mtoto amelala wanamtoa matiti.
Na sasa anaendelea kusuck polepole even as much as analala.
So make sure you're comfortable, make sure your back is resting somewhere. Hata kama ni pillow utatafuta, look for a pillow, put it there, look for another pillow, place it on your lap so that the baby is, now this is the cradle position.
The baby is a nursing pillow, did you know?
Okay.
There's a nursing pillow, you put it, you see these pillows that people that travel use it. But no, it's bigger.
The one with the circle hivi unakaeka hapa hivi. So ina support both the back na inaleta mtoto hapa
closer to you.
So make sure your back is resting. Make sure uko comfortable. Mtoto wako in a good position. Sawa. Then now you can breastfeed. It will make you both comfortable. It will both make you comfortable and also the baby.
The baby gets enough.
So where does the head rest? The head will rest on your upper on your upper arm, and then the rest of the body unaishikilia na hii mkono ingine. Make sure the baby is facing you. Si umshike hivi akiwa ameangalia juu. Make sure umemgeuza like your tummy and the baby's tummy zina
touch,
zinaguzana. And then the other hand now will hold the what?
The head,
the breast.
Oh sorry, yes, the yes, you have to hold the breast.
So you hold the breast. That is the cradle position. I think it's the most comfortable position.
It is. This is existing, but for different circumstances where we cannot encourage cradle position the first 1, 2, 3 days.
And the cradle position tunaambiwa mama, even when you're sleeping, especially for two newborns, too late when you're below 1 month, hata kama ni usiku saa 8, aketi tu and breastfeed the baby. Utapata the moment ameshiba hata kusumbua usiku.
Imagine.
But ameamka, umeng'ang'ana, umemnyonyesha kama umelala. You are uncomfortable, the baby pia anajaribu kufikia matiti afikie. 5 minutes later ameamka tena. Why don't you just sit down, mnyonyeshe for 30 minutes and then sleep, na utapata hata yeye pia atalala.
Because the most common cause a baby being irritable and fussy, kama si mgonjwa ni njaa. Ni njaa tu.
Kukosa kushiba. So apart from the cradle position,
there's the side lying position. For mothers with after CS, cesarean section, or they have episiotomies, or they have been given episiotomies. But yes, ni kama for like what the first day ama the second, then tunaweza kidogo. But once you start feeling like the pain is a little bit less, we encourage cradle position always, because now the baby gets the maximum breast milk vizuri. And there's the football position. Let me tell you, I think we need to do like this
demonstration.
For the positions properly with even academy and everything. Do you think we can do that?
I think we can. Now for the side-lying position, I think it's also just okay for older children.
Yes.
Wale watoto wameshafikisha na huko 6 months, taka mmelala na yeye anatafuta tu
unampatia tu
na unaendelea kulala. I think that is allowed for side-lying.
Lakini the first 0 to 3 months very crucial.
Football position ni yenye you hold. It's usually mostly for twins, for mothers who are breastfeeding twins, sababu utapata watoto wote wawili wameamka at the same time. Hold the head and hold the head.
My Lord.
Then the rest of the body can just hang maybe on
a pillow,
on a pillow. Shika tu hivi wananyonya tu.
We are amazing but women. I
tell you. But I don't think it's a comfortable position. Do you think it is?
Actually, I think mothers with twins or more than 2 babies It's exhausting.
Then of course there are other positions but then okay, those positions we looked at them, but then they are not as comfortable
and they're not common.
We really wanted to insist especially on reducing back pain and making you comfortable.
Making sure we hit all the developmental milestones. Yes.
Okay. Then after positioning, maybe you can tell us how to tell whether maybe your baby is hungry or how you can tell if they've had enough
or enough milk. So how we can tell the baby is hungry is wanaanza kukua fasi. Okay, we encourage feeds for 0 to 3 months, about 2 to 3 hours. Every 2 to 3 hours breastfeed. Every 2 to 3 hours breastfeed.
For the first what?
0 to 3 months.
Unamamsha?
Unajua na vile umeng'ang'ana alale. Hapana, unajua sasa hiyo period imewekwa juu ikifika maybe amekuwa akifeed every 3 hours specifically. 3 hours ikienda kuisha anaanza kuamka na mnaanza kuwa kama baby anatafuta. Of course they turn their head like this.
Okay.
That is called rooting in medical terms. Unaona jua anatafuta matiti. And then there's licking their mouth or their tongue. Ama anarusha
smacking.
Ama anarusha kitu kwa mdomo kama ni vidole kama anaweza kuwa lekio amefunikwa alafu so anaguzaguza leso ama show anaiweka kwa mdomo. Okay, that is the basic.
Then obviously they cry.
Of course utajua tu wako njaa. Enye tunajua if their content, if they are full ni when their diapers for 24 hours ametumia 6 diapers.
That is how to know whether they are getting enough.
Yes. Yes, how to know. So ametumia 6 diapers in a day and they are wet and their pee is clear or a bit pale yellow. Ukiona kama inakuwa mingi sana, I think we need to consult a doctor. Alafu there was how to this nini inaitwa what nini, so apart from diapers the baby is okay. Of course hiyo 3 hours tumesema of course adding weight hiyo tulisema watu wa breastfeed kabisa. And ndio kuna hii ingine hizo 3 hours kama analala vizuri throughout
without waking up.
Sile ati amelala 1 hour
and then ameamka.
Yes,
that is a sign that you're not breastfeeding enough.
The baby is not getting enough milk. Basically that.
Okay, sawa. So like how are they supposed to be adding weight?
Okay,
maybe the first month
the baby is supposed to add we always say 500 mg.
Okay,
that is the minimum. Add a kg, very good mama, you are doing a good job. But the minimum is 500 mg every month, especially the first 6 months. Just when you start weaning off and everything, we shall talk about that. We shall see how often you want your baby to be, or no, how many kgs or how many mgs they need to add. So ikikuja ni less, tutaanza maswali. Because what is happening? Are you positioning? Is your baby getting enough breast milk? How is your latching?
Okay. Is there anything like over breastfeeding?
No,
there isn't. A baby cannot have too much breast milk. For sure, they can't. A baby will always know when to stop.
And
when to stop breastfeeding.
It is the only food. They're not getting anything else.
Unlike us adults who just eat. A baby will always know when to stop feeding.
That's why we say you breastfeed the baby to their fill.
All right. That's good. That's good. Yeah. So I think we can maybe talk about storage of breast milk and pumping. I think we can talk about pumping first. So pumping is pumping versus, what do you call it? Expressing.
Expressing. Yes. Kuna difference.
Ile kukamua. Pumping
Okay.
So pumping or
Expressing.
expressing.
So I'm gonna talk about pumping. When to pump. We encourage exclusive breastfeeding for 6 months. So pumping is not necessary unless it is necessary. So for premature babies, that is when we can say we want to pump, because the baby has not yet matured. There's a reflex we call sucking reflex. The baby will have poor sucking reflex. They will not get enough milk. So we are risking the baby has being sick and everything. So for premature babies, of course, babies that are in newborn units or in intensive care units.
Yeah.
If you have to work, for the corporate moms, you have to go back to work after 3 months. So we pump at that time. Unless, what else? Apart from work, there's also if you're using some stuff that are not supposed to be used, like alcohol and recreational drugs.
We are not encouraging you to use that when you're breastfeeding, but if you have to,
yeah. So if you have to, make sure that the milk that you have pumped is enough, and that when you go back to pump, you have taken 2 to 3 hours after you've used that substance, either it's
alcohol
or
weed
or whatever you have used. 2 to 3 hours.
2 to 3 hours after.
So that it can have left your system. Okay, if your baby is sick, if your baby is sick, and
then there are those babies who just don't feed well, especially babies with asphyxia, babies with who are born like
with conditions kama cleft palate.
Oh right, cleft palate. So usually we pump alafu wanapewa hawa asphyxia hawakuangi wamepata that suckling reflex. So you have to pump, you have to express, alafu wafidiwe. And if you notice your baby is not feeding well, especially hawa mama wenye we discharge, those who give birth to premature babies, and then mtoto anadischargiwa akiwa 1.8 kgs. Usually that is the ideal weight to be discharged with. We tell you to continue expressing at home. Sababu the premature babies, they lose weight when they breastfeed. So unaona mtoto ananyonya vizuri lakini haongezi kilo because most of the energy inaenda kwa kusuck, yet it is supposed to go to adding weight. So if you're told to express, mama, don't ignore. By the way, there are mothers who hate express. Okay, I know expressing is it's not comfortable. But if you're told to express, please
do it.
Just do it. Because it's for the sake of your baby. Especially adding weight. Adding weight is very important. Hatutaki watoto wako na malnutrition. But then do you know malnutrition is among the top 5 among the top 5 killer diseases in children under 5.
Actually, honestly, they die. We have seen so many.
Malnutrition is, and these are things you can avoid. Imagine kuambiwa to express.
Jaribu, just give it your best.
Express, patie tunaambia wapatie either na papas and spoon, ama sometimes syringe,
ama hata bottle. Lakini mostly kama ni mtoto hawezi kusuck vizuri, it's a spoon.
Spoon. So while we're talking about pumping and expressing, I think we have to talk about storage of breast milk.
There's also teething, latching difficulties.
Latching difficulties.
And then God bless and God bless ni hawa wabaya wenye they're being ignorant, wanakataa kunyonyesha watoto. Unapata the boobs zinafura, they swell. Na sasa you're risking even getting mastitis. So when it happens, we can just say then pump or express.
So if you're pumping, you don't have a fridge or a freezer, you're storing your breast milk at room temperature. Room temperature is about 20 degrees Celsius. You can only store the milk up to 4 hours. Okay, of course it depends, 4 to 6 hours. 6 hours is in cold places like Nyandarua, but in places which are hot, Ukambani, 4 hours max. Breast milk at room temperature. After 4 hours, just dispose it. So if you have a fridge, na unaiweka in the fridge compartment, sio freezer, sio pale kwa freezer, in the fridge compartment, your breast milk can be good up to 4 days. And a fridge compartment ni 4 degrees Celsius. It can go up to 4 days. Na kama unaiweka pale kwa freezer, it can go up to 6 months.
Yep.
6 months, your breast milk is still safe.
Wow.
Something to note.
Modern motherhood.
You can even go for a trip to
Imagine vacation.
Yeah.
Okay.
So note that.
Okay.
One thing you should note is that never refreeze breast milk after you
have thawed it.
Yeah, you have thawed it after you had it has been unfrozen. How do you unfreeze breast milk? If it is in the freezer compartment, unaitoa hapo uniweka kwa fridge compartment. Ndio hii.
Iwache kukua baridi.
Iwache kukua. And then you don't microwave your breast milk. The best way to warm your breast milk, if you put it in a container like this, isimamishe kwa maji warm. So this is your breast milk. Assume this is your breast milk. Isimamishe kwa maji moto ama warm until it is the temperature that is imefika ile temperature yenye unataka mtoto
apate nayo.
But this is only encouraged if you don't have another option. If you are able and available, wacha mtoto anyonye fresh milk.
Yes.
From your
You can imagine how you feel when you eat fresh fruit, fresh vegetables, a fresh juice ile ya kuwa blended. It feels so good. Let the baby take that thing. You need fresh milk.
So maybe just in passing as we conclude, hatutaki pia kukaa sana. We're breastfeeding in HIV positive mothers. So they are also encouraged to exclusively breastfeed for
6 months.
For 6 months.
Exclusively.
Introducing
anything. Ata maji. When your mothers give babies maji ati what do they? There's something they just say.
Anyway, then they can breastfeed after 6 months. You can introduce feeds. Then you can continue breastfeeding for up to 24 months. But throughout the period that you're breastfeeding, make sure your baby is on prophylaxis for HIV.
Yes.
Usually kuna zile tu madawa mnapewa clinic. If you're a mother who has been going to clinic and you're HIV positive, unajua mnakuanga mshapewa nevirapine and zidovudin. But nowadays wanasema nevirapine alone. But anyway.
The new updates.
Yeah, the new updates. So make sure your baby is on prophylaxis. And prophylaxis continues up to 7 days after stopping what?
Breastfeeding.
So ukifika mahali udecide ati mtoto hauta breastfeed tena, make sure hizi madawa unampea for up to 7 days.
Ndio sasa useme
your breast milk yote imetoka kwa system yake. But apart from that, I think the drugs we have are safe. And you can breastfeed your baby.
They have worked for so many mothers, and all of these kids that have followed.
If you're a parent, and kila kitu iko sawa, your baby will survive.
The baby won't get the HIV. Fun fact. I know this worries women so much. Breastfeeding also helps you cut weight. It cuts up you burn the extra calories.
Losing the
the fat.
Baby fat.
Yes, baby fat. Hakuna haja ya kuvaa zile
vitu za kufinya
unafinya tumbo for what? Breastfeed the baby diligently and then you go back to your
and family planning. You talk about family planning. It's a natural family planning method.
Yes. By the way, for 6 months you do it exclusively vizuri.
Hauhitaji nini for 6 months. Hauhitaji family planning.
We call it
disclaimer. Usiende upate bimbo useme wale wasichana
it's called lactational amenorrhea.
Okay.
Amenorrhea is just lack of
menses.
Yes.
All right. I think that is it. Thank you so much for watching.
Yes, we hope you've learned very important stuff.
See you in our next episode.
Bye.
Bye.